Good afternoon, or good morning, I guess it's still at this point. My name's Jason Bauza. I'm the first selectman in the town of East Windsor. We're very excited to welcome the governor, the lieutenant governor, and the commissioner of DCF to East Windsor today. This is a facility that has made a meaningful impact in the town of East Windsor for a long time, going back to at least the 1930s when my own family were residents here. So to have this highlighted as a success in terms of the work that the state has done is really an opportunity that we are looking forward to seize on. And I'd like to introduce Lieutenant Governor Susan Byswitz so she can say a couple of words, and then there will be others to follow. Thank you, Governor.
Thank you so much, Jason. And we're so happy to be here to highlight the great work that's going on at Dr. Albert Solnit Children's Center here in East Windsor. Every child is unique, and each child faces different challenges, and those challenges have gotten more significant during the pandemic. And it's up to all of us to make sure that every child has the opportunity to thrive. And so we are here today to see some of the learning opportunities and environments that nurture kids, particularly boys, between the ages of 13 and 17. And we had the opportunity to see how kids with complex needs learn new things, and particularly skills like the very sweet skill of making maple syrup. Very delicious, I have to say. The governor and I enjoyed it. And we had the opportunity to learn about the Young Chefs program, which is just one of the many things kids can learn while they're here. And I am very happy to give a shout out to the amazing DCF team led by our incredible commissioner, Vanessa Durantes. Thank you so much, Commissioner, for the great work that you're doing for our kids. And speaking of amazing staff members, we had the opportunity to meet a staff member who saved a life by using the Heimlich maneuver to save a person who is choking. So this is an incredible staff that do great work for our kids. And with that, it is my pleasure to introduce the leader of this facility, who's been here and has led. His name is Dr. Brett Rayford. Dr. Rayford, can you tell us a little bit about what you do?
Well, hello. We're a psychiatric residential treatment facility, and as noted, we work with boys ages 13 to 17, and they come with us with a complex background. Many of them have histories of trauma or psychosis or depression or anxiety. And we have a really talented team of people, from milieu staff to psychiatrists to psychologists. And we basically create a holding environment for those young people where we can not only address their psychiatric needs, but we're focused on treating the entire person as well as the entire family. That young person lives inside a family system, so we're working with the family and family therapy. COVID has been a challenge, as you know, but we've developed technology to help us with that. We have individual therapy, family therapy, group therapy, milieu therapy, and we just showcased one of our more focused treatments called sensory immersion for the governor. So the work that we do here is really powerful, thanks to our dedicated staff. We look forward to COVID being over so we can get back to some of the other things we used to do. In addition to the treatment, we educate these young men, and as well we develop their work ethic. So we have a very intense vocational training program, which was referenced. The one that's coming online next, now that maple syrup is done, is the car detailing business. And so we have several youth businesses where the young men learn to work. They earn money, they put that money into a savings account, and then they learn how to keep a small business running by putting money into the business to buy products for the next items coming through. So it's with great pleasure that we welcome the governor and his team to see how Connecticut creates and maintains some of the best treatment in the area.
Thank you. Thank you so much, Dr. Rayford. And now it's our pleasure to introduce our terrific leader of our Department of Children and Families, Vanessa Durantes. Commissioner.
Thank you. Thank you so much. And thank you, everyone, for coming in this beautiful day. Thank you, Governor. Thank you, Lieutenant Governor. Thank you, Senator Anwar. You know, to have the chair of the Children's Committee here see this wonderful facility is an opportunity for us to emphasize the standards of care that we expect for kids in Connecticut. Children's behavioral health is something that we have to pay close attention to. Outside of the pandemic, we understand that children have unique needs that sometimes can't be met in an adult system. In the pandemic, we know that the social isolation and the separation from friends and their regular routine has left children in a space of needing some additional supports. Here at the Solnit Center North, the boys here have been here throughout the pandemic and understand the need to have those wraparound services to make sure that they are okay. And so in Connecticut, with the governor's support, we are committed to the mental health needs of all Connecticut's children and a standard of care that we can be proud of. I'm so glad the Lieutenant Governor acknowledged our staff who just jumped into action when one of our kids here was choking on something. So, you know, understanding that they're trained to be able to meet the special, unique needs of children is a way for us to continue to amplify. It's important to tune in to kids differently. So thank you all for coming here today.
Commissioner, thank you so much. And now it's my pleasure to introduce the chair of the Children's Committee. And we're also standing in the midst of his district, Senator Anwar.
Thank you. Thank you, Lieutenant Governor. It's truly heartwarming to be here this morning to join the Governor, Lieutenant Governor, the Commissioner, and all the staff and everybody to highlight something that is something we should all be proud of. In our state, we are taking care of our vulnerable young boys in this facility in a manner which is something that we should all be proud of, and other parts of the world should see what we are able to do. We have to identify ways of strengthening this and also making sure that the DCF work that is being done on facilities like this actually gets more resources so we can expand it. Everybody knows the challenges young boys and girls are having at this time in the pandemic era. We have a way to be able to address some of them. In some of the severe cases, there's a comprehensive strategy that is in place, and the well-being and their ability to be able to sustain themselves and have a job and opportunities is something that is so special that they're providing. So again, what a blessing to have this place being highlighted as a chair, as a co-chair of Children's Committee. This is something that we absolutely have to strengthen and work towards, and we cannot thank each and every person with DCF who's doing the good work that they're doing, especially Commissioner, your leadership, and the Governor, your leadership, and Lieutenant Governor, thank you for your work. Again, thank you for being here today. Thank you.
Excellent. Thank you, Senator. And now it's my pleasure to introduce our Governor, Ned Lamont.
I'll just say that Children's Center and rehabilitative therapy don't tell the story of what Susan and I just saw in there.
Yep.
I saw a place that says, we love you. It says to each and every one of these kids, you're special and we love you. And each one of you are special. We're going to find out what you love and give you that opportunity so you can shine. That's what I saw when I was walking around. I saw the kids were so proud that they were on their way to be champion chefs and loving it and describing their favorite food that they enjoyed. One of the kids are starting to do some car detailing, and they said, my black governor's car looks a little dull. They could maybe help bring a little pizzazz to it. And I took that to heart. Man, you ought to go to this sensory, what do you call it, sensory immersion room?
Yes.
I mean, I just,
We need
if
one
you
of those
have
chairs.
young men, kids, think about coming here, think about visiting, think about taking advantage of the incredible love, attention, and facilities that this offers. Connecticut loves its kids. Connecticut loves all of its kids. And Sal, I was reminded of that every step of the way. And by the way, Vanessa Durantes is working her heart out every day for kids all across the state, and we're so proud that she's working with us.
Okay, and we thank our media partners for coming. Any questions?
How many boys are here now? We have approximately 23 boys here now. We have approximately 23 boys here, and we have a maximum census of 30.
And these are
all DCF referrals, or are these kids who just have needs who can't be met elsewhere?
It is both. Some are young men that are related to DCF, and others are referred from other parts of Connecticut unrelated to DCF.
And could you just say your first and last name and title and spell it for us, please?
It's Dr. Brett, B-R-E-T-T, Rayford, R-A-Y-F-O-R-D, Superintendent of Solent North.
What kind of dilemmas and delays did COVID-19 cause for the facility? What were you not able to do? What did you have planned?
So there are a number of things because we had to sort of contain the campus with the spread as it spread in the community. And so there were community activities that stopped. For example, we have boys who volunteer at the veterinary hospital. That's not far from here, so we couldn't do that anymore. We have boys who volunteer at the soup kitchen in Windsor, and so we had to pull that back. As the virus really started to take hold, we had to stop family therapy visits to campus. We improvised, and thanks to the support of the commissioner, we were able to go to, that happens every once in a while. We were able to go to a technology through Teams where we can do virtual family therapy sessions. But, you know, as you can see, the campus is large. We're able to maximize all the acreage to make sure that the young men are still entertained and getting good treatment. But it did cut us off from the rest of the community. So we're looking forward to getting back out there.
Governor, I know that we're in East Windsor today, but you recently toured the former Connecticut Juvenile Training School in Middletown. Can you tell me about that?
I will. I was there with Vanessa, by the way. We have thousands of kids who are lost and alone down on the Rio Grande border. And Vice President Harris approached me and said, can Connecticut help out? And I said, we're going to try and do what we can. And we took a tour of the juvenile training facility and thinking about ways that we can get back to the White House and see if we can find a way that we can take care of these kids in a humane, caring way and also in a secure way. And that was one of the facilities we thought about.
So are they waiting for, or is the White House waiting for your response?
Do you know the answer to that?
Yeah, they've asked several jurisdictions across the country to be able to help alleviate some of the pressures in the emergency shelters at the southern border. And so I've continued to maintain contact with my colleagues and peers in other jurisdictions to see what it is that the ask is. So there hasn't been an official ask other than what the governor is referencing in terms of numbers of kids. We just have a ballpark. And so what we've been doing is trying to scope out places in Connecticut that we may be able to reimagine the best and humane way to be able to help this humanitarian crisis.
There's almost a visceral reaction in some quarters just because of the history of the facility and, again, how it was used then. So obviously, a building is a building and you can use it in many ways. But would you address that?
I'm so glad you asked me that because it's not almost a visceral reaction. It is. You know, so when the governor and I went there, it was because I wanted to have an opportunity to reimagine that space something differently than it was in the past. We understand that the things that happen there do not comport with the standards of care that we have today for Connecticut. And as we think about the broader impact of what this humanitarian crisis has brought kind of upon our border, we have to think about things differently. We can either live in the ghosts of the past or really lift up the potential for Connecticut's future. And I think what you heard is a governor that's committed to making sure that that can happen. So by virtue of the fact that he tapped me as the Commissioner of Children and Families to not only lead this department, but to lead and consider these efforts, I think he's in the right direction of really understanding the needs of kids.
Do you have a feel for how many children could be accommodated there?
So we're looking at just the square footage, what things could be reimagined there. It's very important for us to have medical care space, mental health care space, much like you see here, outdoor recreation space, indoor recreation space. So if you just took square footage, probably more. Up to the standards of care in Connecticut, probably less, because we want to make sure that we don't sacrifice recreation space just for kind of cot space.
What other locations are you looking at besides the Middletown facility? Are you looking at, what other places? Other group homes that you
So yeah, some of the other jurisdictions across the country are responding with vacant group home space, but for us it's important to make sure there is a secure, safe environment that those kids can be wrapped in the care that they will be needed. They've experienced some really traumatic experiences coming from places in which they've been seeking asylum from. The emergency shelters at the border, we've seen, pictures of, although they are in great shape, there's still lots of kids there with foil blankets, and that's not what we think is the best way. We have to help them kind of alleviate some of that pressure. So we're trying to figure out what's the best way to do that. I'm not necessarily sure that I'm confident spreading kids out across the state gives us the kind of wraparound care we think they need. DCF can, and they've demonstrated that here. A building doesn't care for kids, people do.
When, Governor, do you expect to have an answer to the White House in anything?
I think we're going to make a recommendation or two over the course of the next few days. They probably want to come up and take a look, as they're doing in many other states. They've got some preset impressions of what they need as well.
Have they given you any indication of the time frame, how long these youth might be expected to be out in Connecticut, and it's possible that they can become permanently?
Well, I can tell you the Vice President felt some urgency, and they're talking about these are kids they're trying to place with families over a period of time. They said it could take 60, 90 days. I don't know. Could take a little longer than that.
When did that call with the Vice President occur?
Oh, when we saw that in New Haven. Yeah.
Oh, all right, you came up that.
Yeah.
And Commissioner, you were part of that conversation as well?
Not that specific conversation, but I was privileged to be able to meet with the Vice President when she was here to kind of talk about Connecticut's kids and what standards of care we have here.
Thanks, everybody.
Thank you.
I've got a question on President Biden's executive orders on firearm-related order, ghost guns. We passed a law in Connecticut that outlawed them. Recently, there's been a mother in Watertown who's been arrested after her boyfriend used such a weapon to commit murder of her children. Have you heard anything from the White House? How will that change anything here in Connecticut?
We haven't heard anything from the White House, but I think sometimes Washington's following our lead, Paul, when it comes to safe guns. And the ghost guns is something that we dealt with the legislature, I think, 2 years ago? It was an end around. A lot of guns, a lot of lethal guns, a lot of assault was able to come into this state via online ordering in several different pieces as a workaround. And we're taking care of that in Connecticut, and I hope hopefully Washington will follow our lead on that.
Just another question on the subject. The Judiciary Committee yesterday advanced a bill that would kind of overhaul the state's red flag law, the groundbreaking 1990 law that allows weapons and fire and ammunition to be seized and people being a danger to themselves or others. Do you support the proposed expansion?
I got to look at the details of the bill, but the way you've described it, it makes all the sense in the world to me.
I have a little bit on that. Yeah, so
Go, Vanessa.
one of the things that while we're here, the Children's Behavioral Health Plan got a lot of energy right after the Sandy Hook tragedy. So Connecticut, the governor's right. Connecticut has been right out in front on this particular issue. And so as we look at what the current iteration of a Children's Behavioral Health Plan, we have that always in the back of our minds as we drive forward, because that happened here, right here in Connecticut, and there's no way to separate that from our history.
Governor, I have a real quick question about the vaccine. We're at the point where it's Gen Z is essentially the ones that are now getting the vaccine. Wondering if you have a message for kids that are basically my age who are hesitant to get it. There's a lot of reports that this is the age group that is most hesitant, and just wondering if you have a message for them.
We're beating COVID here in this state and hopefully in this country because people are getting vaccinated, because the vast majority of our people over the age of 45 have gotten vaccinated. They did it because they knew it was the right thing to do for them. They knew it was the right thing to do for their community. And you're right. Now I have a special sense of urgency for young people. They sometimes call themselves the invincibles. You've got to get yourself vaccinated. It's the right thing to do for you and your community. Susan and I have gone to a number of vaccination clinics. Sometimes there are young people there. Wherever I go, I say, tell your friends and tell your friends to tell their friends to come in and do this. Do this on a voluntary basis. Do it because it's the right thing to do. We've got the vaccines, they're available, and it's going to make a world of difference and make for a great summer, but only if you get vaccinated.
And I'll just add to that my son is in that age group, and he's getting his first shot today, and I'm really excited about it. But it's really important that we vaccinate our young people, because we've got these 3 variants that are floating around and becoming more predominant in our state. And it's young people who are getting sick right now. So it's really important that everyone get vaccinated. And we have an effort to vaccinate all of our college students here in the state before they go back home. And that's really important. So we want to spread that message.
Thank you.
Thank you. All right. Thanks
Thanks, everybody.
everybody.